Welcome. My name is Emily Yates, and I am a wellness specialist at PEHP Health and Benefits. Thank you for joining us in this important webinar, starting the conversation about suicide. Suicide is a difficult thing to talk about. It can be uncomfortable, and it can make us uneasy. But really, starting a conversation is the first step in helping those we love and are concerned about. Suicide rates in the United States are going up. In the past 2 decades, the suicide rate has increased in almost every state in the nation, and by more than 30% in the 25 states. More than half of the people who died by suicide had no known mental health issues. And according to the CDC, relationships, substance abuse, health, and job or financial problems are among other circumstances contributing to suicide. So suicide is a deeper, more complex issue that involves much more than mental health issues. And in Utah, an average of 621 Utahns die by suicide each year, and the rate of suicide among Utahns ages 10 plus has been increasing since 2007. Overall, suicide among Utah males is 3 times higher than females. And Utah adults aged 25 to 64 had the highest rate of suicide. While suicide is increasing nationwide and in our state, it's important to note that suicide is rare, and this is important to stress. Humans are very sensitive to information about what is normal. If we hear a trend is on the rise, our brains can easily catastrophize and translate that into everyone is doing it, and that is not the case. Everyone is not committing suicide. Currently, suicide is the 10th leading cause of death, but it's still considered rare and should be rarer. And it's also important to note that suicide is preventable. There are clear ways to intervene, and there are clear things we can do to reduce risk among our friends and family. So for the rest of this webinar, let's talk about how we can help those we are concerned about. If you're watching this webinar, you might already have someone in mind who you are concerned about, or maybe not quite sure but feel like something is off with someone in particular who you care about. But one thing we do know is identifying those at risk is difficult for even the best trained mental health professionals. There's a tendency to think only people with mental illness or sadness are more likely to commit suicide, when in reality, as I mentioned, more than half of the people who died by suicide had no known mental health issues. I really like this quote from Joseph Franklin, who was a suicide prevention researcher. As humans, we look for simple explanations and neat narratives and stories. And it turns out that suicide is just incredibly complicated. That doesn't mean we can't make sense of it. I like this quote because overall it is hopeful. I like that a researcher can say, even though this is a complicated problem, doesn't mean we can't figure it out. So here's what some of the research is telling us about suicide prevention. So, as I mentioned, identifying the risk for suicide can be tricky. But researchers have identified the most common risk factors for suicide. And if you're unsure what a risk factor is, it's basically things like our behaviors, thought patterns, health issues, or other adverse circumstances or experiences in our lives that put us more at risk for something. For suicide, the most common risk factors are a family history of suicide and/or child maltreatment, previous suicide attempts, a history of mental health disorders, including depression, and lastly, stressful life events, things like recent losses, personal challenges, deaths, and financial troubles. Some other risk factors include a loss of a family member or friend, especially by suicide, physical health problems like chronic pain or a traumatic brain injury, and lastly, easy access to lethal means, such as firearms or pills in the home. If someone is at risk for suicide, it will often be reflected in their behavior. And according to the American Foundation for Suicide Prevention, Here are some of the common behaviors you might be observing. First of all, it's not uncommon for a person contemplating suicide to talk about killing themselves or express feeling hopeless or trapped in being a burden to others. People at risk for suicide may also turn to drugs and alcohol and begin withdrawing from social activities and events. Let's take a minute to get more into the specifics about what to look for, and I want to focus on 4 main things: talk, mood, behavior, and life events. For some, there might be a combination of all of these 4 aspects. Others might just have one. But here are some of the main things you should be looking out for if you are having concerns for someone in your life. The first sign to look out for is talk. It is not uncommon for people experiencing suicidal thoughts to talk about it. But the way people express the way they are feeling and talk about suicide can differ. For example, some use indirect language, so they might say things like, "I'm tired of life, I just can't go on. My family would be better without me. I just want out." So with indirect talk, they are not point blank stating they are thinking about suicide. They are just dropping little hints, letting you know what's on their mind. Other individuals experiencing suicidal thoughts may talk about their feelings in a more direct way, saying things like, "I've decided to kill myself. I wish I were dead. I'm going to commit suicide," or "I'm going to end it all. If such and such doesn't happen, I'll kill myself." Talking about suicide both indirectly and directly are both warning signs and should be taken seriously. You might start noticing or have noticed some changes in mood. So specifically things like depression or apathy, meaning they lack interest in the things they used to enjoy, increased rage, irritability, maybe they've become more impulsive, or some increased anxiety, which can be followed by agitation, and then humiliation if they're just really down on themselves. The key is to watch out for any significant change in mood. You might also be seeing some changes in behavior in the person you're concerned about. So here are some behavioral things you should be looking out for. So of course, any previous suicide attempt should be taken very seriously. And acquiring a gun or stockpiling pills is of course a big red flag. And then also this idea of co-occurring depression, moodiness, and constantly expressing feelings of hopelessness. And maybe the person you're concerned about has been putting personal affairs in order, so setting up or changing a will, looking into getting their trust figured out, or life insurance, or getting their personal finances in order. This is a big red flag, and going along with that is giving away prized possessions. Maybe they're suddenly interested or disinterested in religion, or maybe you're seeing an increased use of alcohol or drugs or relapse after a period of recovery. And lastly, if you're just seeing an increase in unexplained anger, aggression, or irritability. Or maybe the person you're concerned about has had some sudden big changes in their life, and that of course can make us more at risk for suicide. So things like being fired or expelled from school, a recent unwanted move, any loss of a major relationship, the death of a spouse, child, friend, especially if by suicide, the diagnosis of a serious or terminal illness, or a sudden unexpected loss of freedom, fear of punishment. And this is true in our elderly population when they lose their driver's license or move into assisted living. That's a big loss of freedom for them. Or maybe it's an anticipated loss of financial security. And lastly, a loss of a cherished therapist, counselor, or teacher. So now that we've gone over risk and what to look out for, here's the harder part, starting the conversation. Starting the conversation about suicide is hard because it's hard for both parties. So let's first talk about those contemplating suicide. When people suffer, it can be really hard to talk directly about how they are feeling due to fear of judgment or rejection. There's a lot of stigma attached to mental health issues and suicide, which makes it even harder to talk openly about, and it can leave people struggling in silence. And for those who are concerned, there can be a reluctance to talk about suicide because there's a misconception that talking about suicide will make people angry and make them more at risk for suicide, leaving people reluctant to even bring it up. When in reality, asking someone directly about intent can lower anxiety, open up communication, and can lower the risk of an impulsive act. Remember, it's okay to talk openly about hard things, even if it's painful and uncomfortable. We all feel better after a good talk, right? Here's another helpful quote. People worry about talking about suicide because it provides people with a script. But when people hear each other's stories of struggling with mental illness or with suicidal thoughts, it reduces stigma and helps people to know they're not alone, she says. And social media provides an opportunity for these helpful conversations as well as harmful ones. The researcher here is referring to talking about suicide on social media, and that's not really what we are talking about here today. But I do like how this quote tells us it's okay to talk about suicide, and it can help in reducing stigma. We just have to talk about suicide in a helpful way rather than in a harmful way. Let's first talk about what not to say when broaching the subject of suicide. Try to avoid saying things like, "You're not thinking of killing yourself, are you? You wouldn't do anything stupid, would you? Oh, stop being so dramatic. You wouldn't actually kill yourself, would you?" We want to try really hard to steer clear of judgmental, condescending, and demeaning talk. This type of talk and communication might make the person feel judged, stupid, or embarrassed, when really they need to be heard, validated, respected, and most importantly, they need to feel safe. So let's talk about how to engage in a more helpful, positive manner to keep all doors of communication open so people feel safe, heard, and validated. Let's talk now about more helpful, positive communication strategies where we allow those contemplating suicide to feel safe, heard, validated, and respected. A good way to start the conversation is to ask indirect questions. So things like, have you been unhappy lately? Have you been so very unhappy lately that you're thinking about ending your life? Or do you ever wish you could go to sleep and never wake up? These are questions that are going to hopefully help open the doors of communication rather than shut the conversation down. If the person you are talking with says yes to your indirect questions, you can then move on to more direct questions about suicide intent. Ask directly in a way that conveys suicidal thoughts are normal and understandable in their circumstances. So you could say something like, sometimes people in your situation feel like they don't want to live anymore, or sometimes they think about killing themselves. Have you been having thoughts like these? Or, you said that you are feeling like you can't handle it anymore. When you say that, what do you mean? Are you thinking about suicide? If the answer is yes, your gut reaction may be to try to talk them out of it or convince them all the reasons why they shouldn't. I know this is hard, but try avoid doing this. You want to validate how they are feeling and not try to solve the immediate problem. You can do this by saying things like, "Thank you for being honest. I know this can be hard to talk about. I'm glad you told me. I think I may be able to help." Or, "It sounds like you are in a lot of pain. I'm so sorry you are going through this." As much as you might want to solve the problem immediately, it's important to know simply being there and listening without interjecting can be very powerful. Just by sitting and listening, you can build love, compassion, and connection with the person you want to help. And you can also gain insight into the distressed person's own thoughts and feelings. And lastly, listening may give you clues on what is happening. Things like what kind of other support this person has in their lives, like friends, families, teachers, coaches, or what kind of coping skills they have that they could possibly use, or if they've reached out to other people for helps. Or maybe you can get a clue into if they've had any past suicide attempts, or get more information on their current suicide planning. Can't you see how valuable it could be just to sit and listen? And if you think about it, that's what we all want really, right? Is just to be seen and heard. As I've mentioned, it will take a lot of resisting the impulse to jump in with a quick fix or to try to talk them out of what they are experiencing. So let's go over some communication skills that can help you out. To keep the conversation flowing, it's important to ask open-ended questions. So things like, will you tell me the story of how you got to this point? Give them time to talk. Encourage them to share. You know, this might be the first time they've opened up, so don't cut them off. Give them time to talk without jumping in to give them advice or to solve their problems. And here's a couple tips for you. Allow yourself to take a deep breath and to stay present with this person in a way that is compassionate, empathetic, and most importantly, non-judgmental. Once you have opened the door to some dialogue, it's time to introduce the idea of getting some professional help. Your job is to find out what's happening, validate their feelings, and then be the link to access resources and professional help. And remember, you might have to help them every step of the way. So it's important to ask if the person you are concerned about has talked to anyone about this. And then from there, offer support. Say things to them like, can we call someone together? Or can we call the suicide prevention hotline together? Or, will you talk to the school counselor with me? I care about you too much to let things go. You are so important to me. Assure them you will help them every step of the way by scheduling appointments, driving to appointments, things like that. This can be very reassuring and comforting to a person who is feeling very overwhelmed with the intense feelings they are experiencing. And you letting them know you're going to support them and help them through this process is going to let them make the first step in getting help. You know, unfortunately, there's only so much you can do if the person you are concerned about refuses professional help. But one thing you can always do is to continue and offer ongoing support by checking in on them and asking them how they are doing and how they are feeling. You can also ask about other coping skills they might have. So you could say things like, what else might help you feel better or distract you from these thoughts you are having? Could we go for a walk sometimes, or a hike, or grab a hot coffee? Things like that. You can also reduce access to lethal means. If you know the person you are concerned about has a firearm, or there's a firearm in the home, ask if you can hold on to it for a while or make sure it is in a safe, secure place. And the same goes for removing any unnecessary medications. And if all else fails, all you can do is check in, offer support, and just be there. It's also important to remember you are not the only person who can help. I have already mentioned risk factors for suicide, but there are also protective factors. And protective factors are the things in our lives that protect us from harmful things like disease or substance abuse. So for suicide, here are some protective factors. So things like connection to friends, family, connection to community, sports teams, a higher power, religion, things like that can help people. And also access to effective behavioral health care. So this is going to be things like therapists or school counselors. And lastly, contact with caregivers, having open communication within a social circle. So I think it's a good idea to brainstorm and think, who else could help in this situation? It's okay, and it can be very helpful to talk with other people and increase the safety net of the person you are concerned about, which can help take the pressure off of you. So we're coming to the end of our webinar, and I just want to remind everyone, never worry alone. And this advice is for all, for the helpers and for those who might be at risk for suicide. If you are struggling in your life, make a plan of who you can turn to for support and connect with other people in your life. That can be family, friends, therapists, neighbors, whoever it might be you know you can count on. And just remember, we're all better when we work together. Okay, so that brings us to the end of this webinar, and I want to take a minute to highlight and review a few things we can do now to help prevent suicide. And the first is to just start the conversation and reach out to friends and family regularly, secure firearms and remove any unnecessary medications. You can download the Safe Utah app and the My Strength app on your phone. And also know the warning signs and take all of them seriously, and become familiar with the resources in your area. Okay, everyone, that concludes this webinar. Thank you so much for joining me today. I hope you all learned something and I could help you in some way. And here are some additional resources for you all. And also, please feel free to email me if you have any additional questions. Thanks so much.